we want to welcome Raessa Bulbulia, who is an occupational therapist, but perhaps more relevant for this discussion, is a mom of a wonderful 4-year-old little guy with Pompey's disease. And so Raessa has had experience, her and her husband, of repeated hospitalizations, some of which have been very traumatic and invasive. Raessa, welcome to our podcast. Perhaps you could share with us a little bit about what you guys have experienced over.
Thank you, Nicole. Okay, so I guess we start with really when my son was diagnosed, because up until then, we really weren't people who were in and out of hospitals at all. I don't think I'd ever had a hospitalization until I had my son. And Zen was diagnosed when he was 7.5 months old, after me insisting that something was wrong. And I must be honest, we had a lot of doctors who did not listen, who just said, stop being a paranoid mom, or stop being a therapist, be a mom. Until he was in heart failure, and then we were taken a little bit more seriously. And that's kind of when our journey really began in terms of hospitalizations. Zen was diagnosed at 7.5 months, and that was our first admission into the ICU. He was in heart failure, and we really didn't know what to expect because we were undiagnosed. We were in heart failure. We were told that Zain actually doesn't have that much time to live, and we should take him home and make him comfortable. And we thought, well, no. We came in with a cough. We are not taking him anyway. And we kind of insisted on the treatment that we wanted. I called up a family doctor who was a specialist in Canada, and I said, well, this is what they're telling us. You need to help me. And he was like, no, this is what you need to insist on. They need to start anti-failure meds, to move him to the ICU because he actually wasn't in the ICU as yet. And then we need to get the ball rolling. And we then had, I think, 6 cardiologists who'd come to see Zain. And the 6th gentleman who walked through the door had said, well, hang on, you haven't tested for rare diseases. I think he's got this particular rare disease called Pompey's disease. And I looked at him and I said, no, I don't think my son has this rare disease called Pompey's disease. And he said, well, I think you should take it as your diagnosis until proven otherwise. But he also looked at me and said, well, how do you know that this is Pompey's disease? And I said, well, I see a little boy with Pompey's disease. And he looked at me and he asked me who it was. And then he said, well, you want to walk out the ICU and go and call his mom. And that's exactly where our journey began. Zain was confirmed with Pompey's disease. And we'd spent 3.5 weeks thereafter in the ICU. We'd started his treatment, his first set of infusions that he needed to start with. And then thereafter, we'd come in every 2 weeks into the hospital for a day to have infusions, which was to replace the enzyme that he's actually missing. So for 2 years thereafter, every 2 weeks, we'd go into the hospital. We'd spend a day in the hospital. They'd try to drip him. He was a nightmare to drip. He was literally a pincushion. We'd get every possible nurse or doctor to try and drip him. It was horrendous, exceptionally traumatic for this little child.
And for you and your husband.
Absolutely, because you are going to a place where inevitably he's getting a drug that's going to help him, but in order to help him, he needs to go through a whole series of tests and scans and drips and whatever it is that needs to be done for him in that day. So as I said, we'd go in every 2 weeks to have an infusion done. We didn't have too many ICU stays within his first 2 years of life. We did have some pediatric ward stays. Those weren't too bad because we could stay with him. Still difficult for a little boy to understand, though, because hospital procedures always tell you when they want to do anything. So put up a line, for example, no, mom and dad, you need to wait outside, which is not always fair because you hear your child screaming and crying. And who does the child scream and cry for? They call for mom, they call for dad, they want mom and dad to hold them. And that's when we quite quickly realized that that's where we need to step in. We are not people who come in once in a lifetime or once every couple of years for something. We are here frequently. And when I say so frequently, Zain, at a very young age, knew how everything in the hospital worked. Some of his first words were hospital-related things. He knew how to play with syringes and a stethoscope and a thermometer and a blood pressure machine and up to date, he will be able to tell you or the sister who's helping him, no, do it this way. Or actually, this works better. He can now find veins for himself because he's so accustomed to these kind of procedures. So that's kind of when we realized, okay, hang on, we need to step in and say, we hear very frequently he has lots and lots of hospital admissions, so we need to be a part of this. We need to help him, to comfort him. Because one thing that I realized very early on is the minute we'd have a hospital stay, and even if it was something that we wouldn't necessarily consider traumatic or more routine, like an infusion, we'd come home with what I would call sensory related issues. So he'd be a lot more sensory sensitive. In the smallest thing would irritate him. He'd become quite oral averse to certain things, certain textures, certain foods. So we'd see the physiological sensory changes as well. So we started to almost put together guidelines in terms of when we go to the hospital, what kind of things make it easier for him. And without a doubt, it would be little things like take things that are familiar to him. So is it our little buddy that he sleeps with every night that needs to come with to the hospital? And that also sometimes makes it difficult because some hospitals have procedures where you can't bring stuffed animals into the ICU, for example, because they may carry infection. Or I think our worst admission was at the end of, or just before his second birthday. It was a cardiothoracic ICU. So they were very, very strict with infection control. And that meant that mom and dad could come in for 45 minutes in the morning, an hour in the afternoon, and half an hour at night. So we could see Zane for 2.5 hours, 2 hours, 45 minutes in an entire day. And he had just turned 2. So he was 2 years old. And he could understand. He knows who's familiar to him and who's not. This is also a completely different hospital. So he didn't know anybody, didn't know the environment. And he was confined to an ICU bed with people he didn't know, and mom and dad would pop in and out. And that was exceptionally hard because when we go in for the visiting hours, so as parents, you leave your emotions at the door and you walk in and you put on a smile on your face and you make that 45 minutes or those half an hours count. Because when you leave, you don't know if you're going to come back to see your child because your child is really, really ill. And also, that is the only opportunity you're getting to see your child. So you want to make that count. But your child is clingy and your child is upset with you because, well, where have you been? And your child doesn't let you out of his sight because he knows you are going to leave and he has no idea when you're going to come back. And that ICU stay was hard because he wouldn't want us to leave at all. And what would actually happen is we'd have to make an excuse. So we'd say, oh, look at something on the window. And then you kind of duck out because otherwise it'd just be hysterical. And no matter how hard your child is screaming, they will still escort you out or ring a bell and say you've got to leave. And I think what made it even harder is he just had a tracheostomy done, so had a breathing tube put into his throat. So he was still learning about his voice. So he would be screaming at the top of his lungs, but you wouldn't hear anything because he was still learning how to speak or use his voice over that breathing tube. We'd spent 3.5 months in total in the ICU during that time. 3 months.
To clarify, 3 months where you were only really allowed very restricted access to him during the day.
Absolutely. We actually got a letter from Zane's team to say that it would be beneficial for Zane's parents to be with him because they see the repercussions when Zane's parents are not with him. And the doctor looked at me and said, well, I'm not entertaining this. We're going to save his life. And that's what matters. And I think the thing that that's something we consistently get told. We need to save his life. Yeah, we need to save his life. And his health when he's in the ICU is exceptionally important. But his psychological well-being is as important. And I say that because when we come home, we have to deal with the emotional trauma that this child goes through. And it is exceptionally hard for children who cannot, at that point, he was 2 years old, he could not verbalize how he felt or understand how he felt. And then something that's also interesting in the ICUs is that they often have different nurses every day. Now, I understand why they do that. Medically, it's fresh eyes, it's someone different. But for a child, they don't get to bond or trust somebody. It's always somebody new. And we found when we come home, then there are then significant trust issues. So can I trust mom? Can I trust dad? I'm angry at mom. I'm angry at dad. And lots of separation anxiety issues. When I say separation anxiety, it's I'm going to get up in the middle of the night and just check that mom is there and dad is there. Or I have to be right next to mom. And when I say it's bad, I could not close the shower door or bathroom door because then would be worried that I'm not there. Or have I done that because I'm now leaving, or have I left him again? And it would take us a few months after that to try and get on top of his trust, his separation anxiety, and general anxiety of what's going to happen next. And admitted again, he had to have actually the tracheostomy stoma closed. And we ran into some complications after that, so he needed the ICU. And this time, before anybody could tell me what the rules were, what the regulations were, because again, it was a different hospital, I just set the boundary from the beginning. And I got onto the bed and I didn't get off the ICU bed. And I said, okay, this is my son. This is what we're going to be doing going forward. And this is what works for him. So it may not be fitting into the regulations of parents can do this or parents can't do this. I'm going to tell you upfront what works for him. And thankfully, we had a team that really accommodated us and let us stay with him in the hospital. And we were, how many weeks? 4 weeks, 4.5 weeks in the ICU this time. But we could stay with him. So between Muhammad and I, we alternated sleeping at the hospital. And we could be with him for 24/7. Obviously, we respect the regulations of the hospital. So if there was emergencies, we'd step out or whatever it is. But we came back with a child who was not so traumatized. This was the first hospital stay that we came home. And he slept well. He wasn't waking up with night terrors, because night terrors was something we would always come back from the hospital with. And we didn't have such bad separation anxiety. And the biggest thing for me is we could help him through everything. So if he was getting x-rays, and it's something I also don't understand. So he gets woken up in the middle of the night to do 5 a.m. x-rays and bloods and whatever it is. And so you're being woken up to things that are traumatic. I need to poke you for bloods. I need to position you and move you around for x-rays. And I need to, whatever it is. But their mom I knew it. So I could be, okay, we're going to wake you up 10 minutes before you're going to need all of this. We're going to talk you through it. We're going to explain it to you. And then use techniques that we had learned at home that help him to do in the hospital. So we could bridge that gap of uncertainty for him, help that anxiety for him. And that made a huge difference. And I know, and I see it. I see it all the time where hospital staff or your team feel parents can get in the way, right? And I think there needs to be a mutual respect from parents in terms of when a doctor or a nurse or any professional is interacting or treating your child, you take a step back and say, I'm letting you do your job or whatever it is. But at the same time, for the health professional to include that parent in terms of how can they get involved to help the anxiety of that child? Because who better to help comfort or reduce the anxiety of a child than that child's parent? And I think that's something that takes a lot of courage, both from parents as well as a healthcare team.
We are really excited to have Dr. Anusha Lachman, child and adolescent psychiatrist and the convener of the Infant Mental Health Master's Program in Stellenbosch University. Anusha, welcome to our podcast. Today, we really wanted to talk about how to support parents whose children are going into hospital. I think for a range of reasons, whether it's your 3-year-old needs to go in for grommets, or perhaps a medical condition has been diagnosed, or something maybe a little bit more kind of uncertain or frightening. But I think for any parent to have your child go into hospital can be quite alarming, can be quite frightening. Parents often will, vigorously look up on Google, and sometimes that can be a much more scary experience. So I guess we really wanted to talk about what tips could we give parents around how they can manage their children and support their children going in, and also how they can manage and think about their own experience of having a child need to go into hospital.
So thank you, Nicole, for having me. I think it's such an important thing because whether we recognize it or not, we often are quite unaware of how strange an experience it is for a child to be admitted to a hospital or to have repeated consultations, or, heaven forbid that we need to have this child have to undergo an anesthetic procedure, which has them knocked out, and we're not really familiar with it if we haven't had an experience ourselves, or if we don't know someone who's had it. So it's a very scary experience to have. I think we underestimate that. Very often, we may have parents who, like you say, Google search every possible side effect and every bit of information which is available online. And I think that's a starting point of where we make a mistake. I think as medical professionals, healthcare professionals, we're often guilty of not giving the correct information in a layperson-friendly way. And so very often, I'm sure if you take your child to a doctor and the doctor decides that this child needs to have an operation or a procedure, they will give you the technical term for it and, kind of explain all the risks and the benefits, because it's what they need to do to medico-legally protect themselves. And so one of my top tips to parents who are going to see professionals with this idea that the child is going to need something is to not go alone. And so the same applies for when you are receiving bad news for yourself. Psychologically speaking, you aren't able to hold all that information if it is presented to you in a manner that signifies impending doom or bad news or some negative outcome. So what happens is we automatically slip into our fear response. And so we only hear the important things about what we can do to survive and what we need to not die, essentially. And we miss all the other details around it. So it's really important to have somebody else go into the appointment with you so that you have someone to discuss and bounce it off after that. Record it if you can, which is also a really useful thing to do. So with your cell phone, record the whole kind of consultation preoperatively, or make notes. And the reason I say that is, going back to Dr. Google, is that it's very unfiltered, non-peer reviewed information. So the difficulty with social media and online presence is that we can literally write anything we want and have it published and have millions of people view it without anybody necessarily correcting it or making it go through a vigorous peer review kind of situation. And that's really dangerous, because you're more likely to have people who've had negative experiences write that online than you are to have people who have had positive experiences. So there's already this bias of information. And information is key, because not only are you less likely to get correct information that's unfiltered, you're more likely to wind yourself up into worst case catastrophizing scenario. Because if you don't have a medical background yourself, and even if you do have a medical background, it may not necessarily be in that field, you're more likely to think of worst case outcomes. And why do we talk all about you and not even mention the child? Because fundamentally, as a parent, you probably read and you're probably aware of the fact that children negotiate their stresses according to their attachment relationship. And in very simplistic terms, what it means is a child is able to negotiate a stressful situation, a negative outcome, a dangerous possibility, depending on how the adult or the caregiver in charge of them negotiates that, or almost buffers it for them. So if you are already sitting with this mountain of information, which may not be correct, and which is really most of the time quite negative, it stands to reason that your demeanor, your facial expression, your response, your everyday mental state is going to be colored by that. And if your child sees in your face and your expression that this is worst case scenario, then what you're doing is you're putting your child at risk. And if you kind of Google, when you do Google around, you will also notice that children have worse outcomes when they go in for difficult medical procedures in terms of pain management, in terms of responses and anxiety and post-operative recovery, if they have operative anxiety that is influenced by the caregiver. So what that means really simply is, if you are falling apart, And if you are mortified by what may or may not happen, then your face is not the last face you want your child to see just before you go in. Rather, a nurse who can be calmer, or the doctor, or your partner, or your nanny, or whoever it is that's helping you in the caregiving of this child. Have that person be the backup. Because as a mom or as a parent or a dad, whoever it is that's responsible for this child, it's your right to be anxious, and it's your right to feel like this is the scariest thing that's ever happened. But it's not okay for the child to think that it's the scariest thing that's going to happen, because they really need to be able to have a filtered version of what's going to happen. I often have people say to me, I don't lie to my child. No, we're friends. We talk about everything. And I would say, why on earth would you do that? You know, your child has friends, your child has peers. What your child needs is an adult parent to take care of them. And if that means not telling them all of the worst case scenario that Dr. Google has told you, then that's what you do. And it's not the same as lying. It's not the same as saying, I promise nothing bad will happen, or you're going to be 100% better after that. It's about filtering out information and saying to them, for example, well, you're going in for this operation, you know, this is the best team that we could find, and these doctors are really experienced, and look at how many other children go through, and it's going to be all right at the end. I'm going to be there on the other side waiting for you. The doctors explained it to you. Do you have any other questions? Depending on the age, of course, of the child, you give more information around that. But information, again, for me, is just key. And that also comes into how comfortable you feel asking your healthcare provider for the right information. Remember, it doesn't matter how irritable the surgeon or the anesthetist or the healthcare provider is going to be. It is your right to ask the information. I, as a medical professional myself, would in 100 times over answer your questions 50 times, rather than have you come to me with a list of Dr. Google's suggestions of what can happen and then want to debate that. So I think it's really helpful for you to ask the healthcare provider. We often have the sense in South Africa that, you know, the medical professionals are untouchable. You can't communicate with them. It's nonsense. You know, they're a service provider, just like you would ask your child's school principal questions, and you would ask the school teacher, and you take them to task. Why not? Why don't we ask the surgeons or the anesthetists or the doctors that are doing it? Because we're placing our children's lives in their hands, literally. So it makes no sense to me why you would feel unable to ask those questions, but feel comfortable getting that information online, which may not necessarily be helpful. The other thing I would suggest, besides the fact that we engage in a knowledge and need to know basis with children, is to really just be sure that we are aware of what stuff we bring into this. So have you yourself had a difficult experience with somebody dying, going into hospital and not coming out again? Did you have quite a frightening experience when you were younger? Even something as simple as going to the dentist, because all those things make an impact on how you are able to react in a situation that you are faced in again. Remember, going into hospital every day is not normal for most people. And going into a really cold, icy theater is also very scary. And it doesn't look anything like it does in the movies. So for most people, it's a brand new experience. But unfortunately, for a significant proportion of our population, it's not a unique experience. Most people have had some contact in an emergency room which ended badly. They know of somebody who's had some level of trauma. And so what happens is when you enter the situation, you re-experience previous traumatic events. And that influences how you are able to, again, negotiate the stressful period for your child. And so we need to have a collective look at what we're bringing into the situation, what we're afraid of. And often we find parents become quite hostile, quite threatening, quite shouting at the staff. And, you know, I read that often on Facebook about, you know, how awful this particular hospital was and how terrible they treated them. And I always wonder to myself, I wonder what's behind that. What was it that really made someone feel so enraged that they needed to come out and say that? And most of the time, I can tell you from our experience looking after 6 children in our setting in Cape Town, it really comes from parents who themselves have had really traumatic experiences, who have had unpleasant exchanges with healthcare professionals. And so then feel as if they do not want to be in a situation of being disempowered again. In that setting. So I guess in a nutshell, that's it. Look at yourself, what you bring into it, and what don't you know, what don't you understand, you know.
So really what I'm hearing you say is that going into hospital is frightening for children and it's frightening for parents. And in some ways, that experience needs to be mediated for both. Of course, it's the role of the parent in some ways to mediate the experience for the child, but perhaps it does require a lot of honesty, you know, for the parent to be really honest with what do I bring to the situation and can I do that? And perhaps in some ways to get parents to give themselves permission that if it's too stressful, if it's too challenging, if you've had too much trauma and you're not going to be able to quite overcome it, whether it's through support, whether it's through information, if that's not going to be enough, then it's really okay to say, you know what, dad or granny or whoever, you take on that role because that may be something that might be too hard for me right now.
I mean, thank you for bringing that up, because that's also something I wanted to talk about, which is also important for a child, especially the younger the child, the more important that is. The person that they see regularly, that they see on a daily basis. And this is not meant to be, something that we look at negatively. But the reality in South Africa is most children are brought up by nannies, by au pairs, by domestic helpers, by grandparents who step into that role as the primary caregiver. So it makes complete sense that when a child is feeling really stressed and it's a situation that is really not helpful for the child to be alone, are you the best person to be there? Or could we actually rely then on who is the actual caregiver of the child? And you'd be surprised how comforting it can be for a child to be in the presence of someone, be that the nanny, the grandparent, the domestic helper, to be in their presence when they're going through a frightening experience.
Anusha, I just want to say thank you so much. I think that's such invaluable information for any moms or parents with children going into hospital. I think you've given parents a lot to think about.